The answer to that question wasn't at all what Sanjay expected. In fact, he says he was not only stunned by what he discovered, he now admits he was flat out wrong about weed in the past. For nearly 45 years, marijuana has been classified as a Schedule I substance. In a CNN.com article, though, today, Sanjay wrote this: "We have been terribly and systematically misled for nearly 70 years in the United States, and I apologize for my own role in that." Dr. Gupta is joining us right now. Sanjay, you were very critical of medical marijuana for a long time. You've changed your mind. Tell us why.
Well, there's a few different reasons, but, I'll just preface by saying, look, I didn't dig deep enough. I didn't look far enough. I didn't look in other countries at smaller labs. I didn't listen to the chorus of patients, legitimate patients who are getting relief from this, from marijuana when nothing else worked for them. But let me say, Wolf, if you were to look through the medical journals right now about articles regarding medical marijuana, you'd find lots of them, up to 20,000 articles. The vast majority, more than 90%, are designed and to look at the harm, the problems with marijuana, medicinal marijuana, and less than 10%, around 6%, actually to look at the benefits. And I think it paints a very distorted picture, and it's part of the systematic misleading. When you look at the Schedule I classification of marijuana, if that's all you know, what you hear is that it is one of the most dangerous substances out there. It is a drug of high abuse, and it is a drug that has no medical applications. And what I learned after you do some of this digging is that none of that is true. It is not a higher drug of abuse as compared to drugs that are scheduled lower. It does have medical applications, and I think that was part of what made me turn around. But a lot of this was about the patients, again, who were using this as a legitimate medicine, legitimate patients, and getting really, really objective relief.
You also say, Sanjay, there's a lot of hypocrisy out there when it comes to marijuana. What do you mean by that?
Well, part of it is that, look, we say that this has no medical applications whatsoever, and yet there are lots of studies out there that are now showing the medical benefit, even if some of those studies are done outside this country. We classify it as a Schedule I substance. To give you some context, Wolf, cocaine is classified as a Schedule II substance. Let me tell you something else that I find very interesting. We haven't talked about this much, but the United States, through its own Department of Health and Human Services, actually has a patent on marijuana as an antioxidant and neuroprotectant in the brain. So on one hand, they say it has no medical application. On the other hand, they say we have a patent on it as a medical application. So, look, I think journalists are trained to hate hypocrisy, Wolf, no matter what side you're on or what you're thinking about. This is hypocrisy.
No, it's a good point. I know you did a lot of research for this documentary that will air this weekend. Is there concrete evidence, though, concrete scientific evidence that medical marijuana works better at treating certain medical conditions than pharmaceutical drugs?
I believe there is, and I've seen examples of it. First of all, I've seen the studies. So this isn't just anecdotal information, anecdotal knowledge anymore. There are studies to back this up. But I think I'll give you a couple of quick examples. With regard to something known as neuropathic pain, neuropathy, that can be that sort of pins and needles sort of feeling, burning, lancinating, as my patients have described it, feeling in your limbs. It can be very hard to treat. And the way that we often treat it now in this country is to use medications like narcotics, poppy derivatives such as morphine, Dilaudid, OxyContin. We know that marijuana can actually have a significant benefit towards treating this sort of pain. Sometimes it can work, not only work, but it can work when those other medications didn't work. And there's something else that I think makes this very, very relevant, Wolf, and that is when you talk about these narcotic pills, someone dies of an accidental overdose in this country every 19 minutes from taking these prescription-type pills. When we did our research, we could not find any evidence of a death from marijuana overdose. So you have a drug that works, you have a drug that may work better than what else is out there, and you have a drug that, from a critical safety profile, appears to be safer.
It's amazing information. Sanjay, a lot of the documentary that will air this weekend focused in on medical marijuana, to be sure. But what about when it comes to recreational use of marijuana, just for the fun of it or the pleasure of it? What did you find out about that?
Well, look, I mean, I think for my purposes and for this documentary, we draw a distinction between the two. I mean, we're looking at medicinal marijuana. Recreational marijuana, I think, is in a different bucket. But let me say a couple things since you raised the question. First of all, in no way do I think that, recreational use for kids or for adolescents or even for people whose brain is still developing, probably up to age about 25, it could be more detrimental in those people. I mean, I have kids. I think about this. I know they're going to watch this years from now. So, I think that's very important to state. But if you're going to ask about the moral equivalency, marijuana versus alcohol, which always comes up, marijuana is less addictive. About 9% or so addiction. That is a agreed upon number. Alcohol probably closer to 15%. But the withdrawal from marijuana, insomnia, sometimes nausea, with alcohol, the withdrawal can be life-threatening. I've seen this, again, as a physician. It can be terrible. And again, I don't know of any documented case of someone dying of an overdose on marijuana, yet it does happen with alcohol. So, I mean, I hate to draw the moral equivalence because I think it's not that relevant, the argument. The argument about medicinal marijuana should stand on its own, but this always comes up, and that's what I would say about it.
Powerful information from Dr. Sanjay Gupta, as usual. Sanjay, you've done a great job. Thanks very much for joining us.
Thank you, sir. Appreciate it.
An important note to our viewers, The Weed is a fascinating documentary. It will air right here on CNN Sunday, 8 and 11 p.m. Eastern. You will want to see it. And read Sanjay's article on CNN.com, a very powerful article as well.